So welcome. I did not make a PowerPoint because I tend to read it out loud, and you guys can all read. I just want to tell you something, and I have 20 minutes to do that. And in the meantime, while I'm telling what I want to say, you might want to think what ethical problems arise here. This University of Applied Science is a key word here, which is not a university. In Dutch it's called a HBO, which is, some say, a bit lower than the university, but a HBO, or University of Applied Science, is created to solve problems in a practical manner. And this is actually, as you can see, balancing ethics and urgency, designing a care robot. So what's the problem here? I've been asked, in the Netherlands we have a shortage of staff, as we have everywhere. And physiotherapists from a care institution, they asked me, because I was at an applied science, a University of Applied Science, I could fix problems. Okay, fix this problem for me. And what I needed to fix was the fact that we have a lot of geriatric patients who have a stroke. And when you have a stroke, sometimes you are paralyzed from one side. It's called hemiplegie. Usually you go to the hospital when you suffer a stroke, and afterwards you will go to a home like where they practice with you, because the first 6 to 8 weeks, if you practice a lot, you get your abilities back. But nowadays, especially with the care institutions are full. So what nowadays, you get sent home with a paper. You have seen a physiotherapist, and the physiotherapist, they say you have to do this and this and this exercise every day, or 3 times a day. If this would happen to me, I would for sure exercise every day, because otherwise I would stay paralyzed, and that's not what I want. But in the case of the geriatric patients, they don't practice, they don't do their exercises at home. And this is a huge concern for the physiotherapist I spoke, because they said they will stay paralyzed if they don't exercise. But we cannot motivate them to do the exercise, because we are loaded, we are full with other patients who are far more worse than this. So could you please, in what way can technology, in what way can AI help us to solve this problem? Now, so I went, we have designed, I'm sorry for my English, we have designed a care robot, which is this big. And, this is, you can say this is actually the prototype right now. And the whole idea is that when you have this stroke, and you are sent home with a paper, with the exercise, but when you are geriatric, just I told you, you don't practice at home. And this is not so much that you forgot, although this is a reason, but the main issue is that especially when you're old, and people tell me that, people in care industry tell me that, you are very depressed. So you had already illnesses related to your being old, and now you are paralyzed as well. Life is not good enough for you anymore. So you don't practice. In Dutch we say, laat maar, never mind, I'm old as it is. So I am not going to practice. So what is the idea of this robot, and what ethical problems, and what do you mean balancing between urge and ethics? Okay. This robot is called Isha. Isha is meaning doctor in Japanese, and later on we figured out it was an interactive, smart health assistant. So when you have this stroke, and say I I'm John, and I'm old, and I have a stroke, and the physiotherapist is really thinking, okay, if I send John home with only a paper, he will not exercise. In this case, I might get to borrow Isha. It's called Isha. So Isha is at my home, at my table, and it will 3 times a day awaken. So the ears will go up, and he will turn around and look for its owner. Where is my owner? Where is John? And if he spots John, or movement in general, he will call, John, time for your exercise. Would you come over? So I'm John, and I come over, and I will sit in front of Isha, and Isha will tell me, please sit up straight, because the cameras need to see him. Sit up straight, be good in the middle. He has to establish that, in fact, I am John, because the right exercise with the right person is actually key. The exercise is shown here on the belly. And say, for instance, you need to push your hand up like 10 times. You need to do this 10 times. And Isha is showing that exercise, and say, well, John, are you ready? And so say, John is, yeah, I'm ready. And he starts to exercise. So Isha's going to tell, count, 1, 2, etc. And Isha's also going to say to John, very good done, a very good job, keep up the good work, and so on and so on. But what if John is experiencing pain? And here's the first AI thing already. What if John is experiencing pain? Then Isha needs to stop, because in pain you should not push somebody to do an exercise. But also, the physiotherapist wants to know that John is in pain and what is happening at that moment. So we figured we will videotape the whole session. If everything goes well, the physiotherapist gets into his mail that John at his home, because this is all at his home, has done his exercise in the right time and in the right way. He's just going to see whether or not it's the right way, because nowadays you're going to measure the angles. Say if this is not good enough, it needs to be higher.
Okay. So
but then, okay, then John is in pain, and the physiotherapist needs to know. We have videotaped the whole session. So we have logged data at that point, where, say, at 2.14 and so exercise, John experienced pain, and we stopped the exercise. So in that way, the physiotherapist can just go to the clip, see what actually is happening there. John may be performing it not right, or in other way, John might also be not motivated enough to do the exercise, like doing like this. And in all that cases, the patient comes back to the physiotherapist. So why is there a problem here? Well, you can probably have heard already a lot of AI sensitive data sending. We actually have a diagnosis inside of Isha. The diagnosis that this is not good enough and this is really good enough. A diagnosis pain, but we not have a data set yet, because the data set for recognizing emotions is very, very, very difficult in this way. People are old. The basic emotion is depressed, and one of the phases is not working.
Life is much more slow.
So you need to. We need a whole database to do that. We need to practice with patients, because actually we do at the moment, and this is the problem. Oh, I see. I have not that many minutes. The problem is we cannot actually test, because of the rules and regulations there are. Of course, you can test, but I'm working with students on a HBO, and I have students half a year, And then they graduate, and I have new students, and then they graduate, and I have new students. And
¿Los temas o los speakers o what?
I am designing Isha, and I want to test with patients, but this is difficult because of the medical device regulations and because of sensitive data going around. So, am I against all the rules and regulations? No, no, absolutely not. But I do say we need to balance somehow that testing should be possible because we are using a lot of sensitive data. That he is a patient, that he is sick, that we videotape it. We have diagnosing the patient, and anyway, I cannot test, and that's what I want to say here. And you cannot help this anyway. But when you're university, you might want to. You have lots of times, and I do not have I do not have that time. So say I want to test with 4 or 5 patients. I'm looking at ethical approval about 1.5 years to do that, and then I only want to test. Can you hear? Can you understand, Isha? That's the only thing I want to ask. Can you understand Isha, and can she understand you? Can she read you? So at this point, Isha is almost finished, but I'm holding back on the testing because I am not a company. I do not need to make any profit of this. My first concern is getting students to work on ethical and societal real problems, and that works. But will I go to all the trouble for launching it into the market? Actually, I don't think so. At the moment, I am only interviewing and testing physiotherapists because there's no problem there. I can ask physiotherapists whether or not they will use such a thing or not. I have time for questions. Because I feel the English is difficult, and especially I did not want this PowerPoint because I will, I just wanted to tell you about. Hey, we're working on a rehabilitation robot, and he needs to motivate you. And what if, like I'm John and I am paralyzed, what if I don't feel like exercising? Then the whole idea is that Isha wants to play a game with me, so he's going to play a game, and the game always involves hand and eye coordination with the brain. Okay. I think I am actually done right now, so there would be time for questions if you have them, of course. And this is actually a cri de coeur from I would like to bring this to life. I would really like Isha to the market, or to the physiotherapist actually, because I don't care about market. I care about physiotherapists. And at the moment I'm not able, and there is a big chance I won't be able to. That she will be in a closet. We said we put it in a closet and start a new project. This could be very well the case that we have to do that instead of going on. Is anybody having a question?
Hi.
Hi.
Yes, again, sorry if I missed at the beginning, but so if I understand correct, you're saying you're having trouble testing it because of the medical device.
Yeah.
Could you approach the testing more as a preventative health solution? So with the features that you have in it, if it is being kind of tested as a preventative behavioral health, just to start with, is that something that would be possible?
It could be, but we always have sensitive data on our hands all the time, always, because people are sick and old, and So I don't think so, because because it is sensitive data we're working on here, and because I would like to test it but cannot at the moment. I don't think that would be a real solution. I don't think there is a real solution, by the way. No. Oh. Oh, this is actually a good idea. Because we don't have the European role. I kind of like the idea, but would that be ethical? Would none. Yes. Yeah. Okay. Did this?
Exercise for your students to try to contact
To different universities or find them outside of Europe. Good idea. You have a question as well.
Similar to this idea, have you ever considered working with a large assisted living facility type company that has several geriatric residents, but all within the company? And in the United States, we have HIPAA compliance stuff, so all of their data stays within the HIPAA compliant.
Within the care institutions.
And then you can combine the data so that you can actually connect it to any individual person for the research portion of it.
We could also try that. Yeah, I think so. It's time, I guess. Yeah, it is. Yeah.
I suppose with physical needs and the kind of healthcare crisis and social care crisis we have today, and the crisis of loneliness, without technology plugging the gap, I think we're heading to quite a dark place.
Yes.
The fact that it is somewhat disheartening to hear that research is hampered by those guidelines, and in a way it feels like it's unethical for those frameworks to be stopping us addressing the kind of social problem. Do you think reform is needed in those guidelines if they are not achieving what they need to do?
I think so, yeah. I think the guidelines need to be adjusted for, say, like testing. So yeah, I think I'm really trying. You mentioned loneliness, and I'm at this tripping point now. Should I develop Isha any further, or should just leave it like that because of the rules and regulation I'm entering now? And actually, I have another question already, stating what can technology and loneliness? What can you do for us? And I have I have ideas already, which I can do. There was another question over there. Oh, sorry.
In research, I believe you have ethical boards for when you want to do specifically for clinical research to validate that the way you want to do the methodology you want to do the research is clinical, so that you can go forward with it. Don't you have something like that for this sort of study where you can ask for an exception that you can go against the guideline because it's a bit like medical treatments. There's the risk and the benefit. If the benefit is higher than the risk, then maybe the guideline doesn't apply. Do you have such a thing to get that sort of right?
I might try that. Yeah, I might try that. So I'm thinking, yeah, is it worth the hassle? Is it worth the hassle for? Yeah. If I ask physiotherapists, they say, please give us this thing, because we know that this will make the difference between being able to walk for the rest of your life or be paralyzed for the rest of your life. And it's against their worth ethic that they send people home, and actually they know that they will not practice. And we don't know for sure if people will practice if they have a care robot at home. But the first results with students, I do test with students, of course, are actually very hopeful. And the ears work a lot. The ears work a lot because the ears are designed that when Isha is out. Out is not a word. Off. When Isha is off, the ears are down. So you, for the user, knows. Okay, I'm not videotaped right now. I'm not this. I'm not that. And when he turns on, the ears will go up as well. You have a question?
Yeah, first, thanks for the organic approach to the story. Appreciate the no slides approach.
Okay.
Yeah. And second, I was just thinking like a radical idea, also based on some startups.
Yeah, this is why I'm here, to collect these radical ideas. Yeah.
What about synthetic data to actually test this? So instead of like recording a real person in their real life environment, actually using synthetic video of like a...
That is a
like
very good
patient.
idea. Yeah, we tried having create faces with AI for for our database to test whether or not it's. But does it work in real life? We actually don't know. Yeah,
makes sense. Like just as a step towards like as a prototype, basically.
Yeah. Okay. Thank you. Thank you for your compliments.
We are out of time now.
Yeah, we're out of time.
That's right.
Okay. Thank you. I'm
Thank you so
sorry
much.
for
Round of
the
applause.
English, but.